Hello. Yeah, actually, here we are going to discuss about the health psychology. First, in health psychology, what we are going to learn. What is health psychology? Actually, in health psychology, we'll discuss about the psychological aspects and biological aspects and the social aspects. In social aspects, family, relationship, social support, all these factors will come. In psychological aspects, what are the things we are going to discuss? Thoughts, beliefs, and all these things. And the feelings, emotions, and the behavior part, all this comes under psychological aspects. Biological aspects, I don't need to explain. Biological aspect means it's all about the genes and genetic prospect. Genetic prospect in the sense it comes under hereditary and it comes under genetic disorders. If the person families are having any kind of the genetic disorders, yeah, even the people may touch. Actually, as per the American Psychological Association, health psychology helps patients to manage the chronic diseases. Okay. And here, whenever people are getting any, they will seek the professional help from the doctors. At the same time, nurses and all people. And this health psychologist will help professionals, and they're like a bridge in between the patient and the professionals, doctors. Here, they will help. Suppose if the person is suffering with anxiety, okay, how to reduce the anxiety and stress because of the disorder. So this health psychologist will play a role here. Okay, people will help the patient how to deal with health. Actually, I health and the behaviors of the patients. And it will them even get and they don't have a concept of health. Will explain the role, what the causes they have to, how it's affecting their health in the prospect. These people will help All these things will be taken care by the people. They will help the people. So we need to see how these things work with the people and how we can affect, how we can play a role. And see, first, what are the components of health psychology? First thing, whenever we are discussing about the health psychology, we need to see first thing comes under physical, second one comes under psychological, and the third one comes under social aspects. These are the three aspects deal by the health psychology. Okay, we already discussed about the definition of the health. Okay, what is the definition of the health from WHO? Health is a state of a complete physical, mental, and social well-being. So all these three aspects is covered by the health psychologist, health psychology people. Now, what is physical component? Actually, whenever is there any absence of health, or what defines health? Absence of any disease or disability of any part of the body is called illness. We can call it as a sickness. It can be defined as the ability of an individual to perform their duties without having any physical limitation. See, one person having some kind of physical limitation, then we can call him as he has some challenges. The disorder is there, some disability is there. So here, the physical health is also defined as the optimum functioning of the body by exercising, eating healthy, and maintaining the recommended body weight. Now we'll see the psychological aspects. What are the psychological aspects? We need to understand in psychological aspects functioning of the body. Psychology health is also important component of health. Okay, here, if the person is actually in this, the behaviors, okay, what kind of self-awareness we have and identity or even the ability to make logical decisions. These are comes under psychological. See, someone is having an issue with decision making, then it's a issue with the person. Someone is unable to concentrate something. Someone is unable to take care of himself. Someone is unable to follow the instruction. See, all this comes under psychological aspects. So here we need to check here. And the emotional health of the person can impact one's physical health. Like in the case of okay, here, sometimes what will happen, they are unable to follow the instructions, they are feeling hungry, they are unable to eat, and they are unable to get sleep. All this comes under psychological aspect. One means here the physical body is unable to sleep because he is thinking, overthinking. The whole night he is thinking. He's unable, he's hitting the bed, but he is unable to sleep. So these comes under psychological aspect. Now social aspect. What are the social aspects? Actually, in the dimension of the social health, okay, if the person is ability of an individual to make and maintain acceptable and steady relationship. Suppose if the person is unable to maintain the steady relationship, then it's called there is a disturbance. Okay, suppose if the person is unable to follow the social rules or society norms, then we can call it as a he needs to develop in the social health relationship. Means here we will see health psychology focus on the well-being and even the social how the person is because how he got restricted because of his disease. So all this comes under social health. Now we will see what is the definition of illness and wellness continuum. Okay, what is illness? Actually, here it is not good to be overweight. Someone will say, "Oh, smoking is injurious to health." Okay, see, all these are dangerous to health. Okay, suppose if you are taking more oil, you are not going to maintain the physical good health. Okay, suppose someone will say, "These are all the continents of the health." Okay, they will say, and these are the physician. Okay, actually, here the think mm, someone said, "Okay, I'm not eating. My sugar levels are high." That means he's ill towards what sugar. Okay, actually here in 1972, they explained about the well-being. Much well-being is the uh, absence of illness, but also the presence of good mental and emotional health. Okay, here wellness continuum in 1972 is defined like this. Here, actually, with this statement, Travers disagreed. Okay, even but here we need to see whenever the person is not good. his degree of illness is not having good health. Okay, we need to check all the aspects why this person is not having good health. What are the components affecting him? Now we'll see the definition of health psychology. Actually, this definition is drawn in 19th century, marked by landmark in the field of modern of medicine. Okay, man was studied using physical investigation and medical examination. Actually, mm, the origin of species by Darwin theory. See, he explained about the evolutionary process. Okay, actually, this theory identified place man and suggested that we are part of ever evolving and ever progressing nature. Why? See, you can see the evolution of the human being right from the beginning to till now. Okay, all these things. Health psychology is discipline of psychology that applies psychological theories, even the research to illness. What are the reasons for the illness and healthcare? Okay, here health psychology is completely concerned about healthy eating, practicing practitioner patient relationship, okay, and patient's beliefs about the health illness. These are the aspects only covered by the health psychology. Even the professional contribution of the discipline to the promotion and maintenance of health. The promotion and maintenance of treatment is leads to dysfunction. Okay, this one is the statement was given by Mr. Madrajo in 1980 and 1980 at one point. Health psychology can be defined discipline that identifies and understands studies the biological aspects and the psychological, even the cultural and environment factors, which contribute the physical illness to prevent from the illness. So all these things we'll discuss in health psychology. What is the nature and scope of health psychology? Whenever we are taking the subject, we need to see what is this nature. Okay, what is going to the interdisciplinary field is explaining about that. Okay, and we need to see what is the scope for the health psychology. See here, the statement is given by Marx et al. What he said in 2005, health psychology is an interdisciplinary field concerned with the application of psychological knowledge and techniques to health, illness, and healthcare. Okay, so here in the health psychology, we will see what are the techniques in health, and we will see what are the illness, what kind of illness is there, how the person is suffering with the illness, what it's impacting towards his health care. Now, first thing we will address the issue, then how to take care of the person. All these things we will it comes under nature and psychology. First thing, we will understand his psychological aspect. Based on that, how he is behaving and how he is maintaining the social relationship with people. And yeah, these are all the things. See, whenever the person changes the lifestyle, it even affects the emotional process. Why? Suppose the person is staying in a gated community. His emotional state little bit high. Suddenly, due to his health or sickness or financial issues, whatever the reasons, suppose he posted to the normal colony. See, his lifestyle is changed, then he needs to get adjust. All these things towards the sickness also. See, one person is walking every day from third floor to first floor without taking a lift. He's using by staircase. Okay, suddenly some disability happened. He's unable to walk. So what is condition here? He may feel stress. He may get into depression. He may get into any kind of emotional distance. So all these things we need to address the psychological, psychosocial needs. Not only that, he feel low. One means his state of what do you call lifestyle is changed. He needs to use lift, otherwise he needs to move to a ground floor, means to the different apartment where he can survive without lift also. So all these things cover here. And what are the scope of the health psychology? Actually, clinical health psychology. In clinical health psychology, actually here people will discuss about, people need to understand about impact of a stress, what leading to smoking. See, suppose the person is started smoking, what is his behavior? Why he's smoking? People will say, see, I'm in stress, let me have some smoke and come back. Okay, the person thinking too much. Again, he'll say, see, let me have. The person worked hard. He will say, no, 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 let me have some drink in the night. Okay, these are all things under clinical health psychology. Okay, but here the field is most established for 4. Okay, here we need to understand. Okay, why these people are behaving like this? Actually, in health psychology, we have three domains. Like first one is clinical health psychology. The second domain is public health psychology. In clinical health, we will see the smoking. What is his behavior? Why he is doing? These are the things we discuss in health clinical psychology. In public health psychology, actually here we only concerned about the general population, specific vulnerable groups, and health policies. What is the outcome towards that? Suppose if the person is presence of any disease found in people of different or specific ethnicities or physical locations, and how help should be provided to them. See, we already discussed one case. The person, he's staying in the third floor, they don't have lift, so how to manage the person? Suppose if he wants to have some peer relation or he wants to communicate. And so public health psychology will cover how to deal with the public. This multidisciplinary field draw completely from the epidemiology as we all as well as in psychology also. But this field will help the people what are the things uh, they're getting and how to provide the basic solution towards this problem. Okay, next, community health psychology. These are all the subfields of the health psychology. Community health psychology will completely focus on social changes and the research methods or participate research and action in research. Actually, here, this field completely works towards the emphasizing the need to develop and improve the health of the community. This completely focus on the community groups only. Actually, most of the time it's completely research based. They do a lot of research. How this community needs to survive. What are the things they need to improve? And what are the things it's emphasizing? And where people needs to develop. So this is completely in basis based. Yeah, it's completely, they will work upon the social changes. Okay, it's a research based. Next, critical health psychology. Actually, it's concerned with the greater influence such as economics, power, and social institution on health and healthcare. See, on health and healthcare in the sense, it analyzes the assumptions and disclosure in the field of health of researchers and health professionals and policymakers. Actually, here, this critical health psychology subject are people, critical health psychology people. They will build, mm, they will help the policymakers also. When people are making policies, okay, what is the economic cost? How can they reduce? What are the social institutions are providing the help to the people? So these are all comes under here. So in the health scope of the health psychology, what are the things we can see? What are the four things? First one, subfields. Subfields of clinical psychology is one is the clinical health psychology. Second one is public health psychology. Third one is community health psychology. Fourth one is critical health psychology. So someone wants to be with the critical health psychology, they need to work under, or they may work under policymakers. Okay. Here, community people means, yeah, it's completely researched. And public health means here they will understand what are the multidisciplinary fields they need to understand and what are the specific ethnicities or physical locations the people needs whenever they're getting. Health psychology we already discussed. If the person is smoker, how to get. Now goals of psychology. See, now we understand what are the various things, disciplines. Now what are the goals? Okay, when we are understanding the goals of health psychology, we need to see first understanding, explaining, developing, and testing theory, and putting theory into practice. Okay, and understanding, explaining, developing, and testing theory. Actually, here, most of the heart diseases are related to behaviors such as fatty food intake, lack of exercise, and smoking. Okay, this is the statement has given by the some doctor. So here, what people needs to understand here, what are the psychological factors? People, whenever they know about their heart disease, they'll come, they have a stress. They'll say, "I'm feeling stressed." Okay, and I value my health. I'm healthy. So these are the actually here what is their health status? They got sick because they got hot. Okay, but what are the reasons towards this? Smoking, drinking, eating. Okay, screening or exercise, lack of exercise. Okay, these are the things will be there, psychological factors. And so here we need to understand these are the things. Now, how to make the person, how to explain. So first thing, we need to assessing the interaction between the psychology, physiology, and psychology. See, now we understood the person is suffering with the heart disease. Due to what reason? What are the physiological reason towards the disease? Healthcare professional will help the person here. So might be smoking, drinking, or eating, or excessive screening, all these things, or lack of exercise. Okay, so here we need to understand, we need to explain, and we need to help the people into the coping process with the social support, whoever is there in the family and all other things. Okay, here the role of the psychology while experiencing illness. First thing, the health psychologist will explain what are the reasons for the illness and how to overcome psychologically. So he will understand and they will elevate the pain, what do you call pain relieving, pain tolerance or pain management techniques. Okay, all these things will taken care by the psychologist. And even the role of psychology is treating illness also. For example, change behaviors that lead to stress could reduce the chances of a heart attack. See, suppose if the person is understanding how to take care of his stress, then if the stress is reduced, what will happen? The chances of getting hurt with the heart is also reduces. So, and putting theory into practice can be implemented by these people. Suppose the people say, see, avoid oils, go for walk, okay, don't do much screening, okay, don't take any stress, do meditation, do breathing exercise, okay. But these are all the theory parts, okay. But who will make them to practice? Okay, here putting the theory into practice. This is also one thing, and promotion of healthy behaviors. See, here we need to understand the person disease, and we need to help the people to enhance their behaviors in a positive prospect. First, understanding their belief system. People will say, I don't change. I'm eating like this with lot of sugars and what we call carbohydrates right from the beginning. I can't avoid oil. I can't eat idli without ghee. So heart patient the person is. But here we need to understand. So here prevention of illness. See here, when the person is like this, then we need to promote him towards the healthy behavior. Then we need to understand prevention of illness. Suppose if the person is suffering with the heart attack. Okay, now we need to help them. Please try to quit the smoking. Okay, suppose if the person started smoking, the even the peers have the heart diseases in their family. We already discussed hereditary. Health psychologists will focus on the genetics also. They come to know that they need to explain. See, hey, no, 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 your family have these things, heart disease and all. Okay, they do have a lot of cholesterol in their body. So please try to avoid smoking. So here what they're doing, the health professional, prevention of illness. So they're saying you may get heart attack, please avoid smoking. See, you may get a heart attack, try to avoid sugars. Right from the beginning, they will say. Okay, even if the person is suffering with one disease also, they will help. So here, what will make them to understand more? So putting theory into practice, promotion of healthy behaviors, and prevention of illness. And here, next we'll discuss about the history development of health psychology. Okay, actually, what is this need? Health psychology need in the why we have to choose as a health psychology? Why do we need to study? Actually, Actually, here there is a huge gap in between life and death has become longer than yes, like previous years. Okay, so here the time stands for proof that every single day we were new disease and illness is coming, and people are coming with the new diagnosis and new diseases. Okay, and actually here the introducing of the sustaining life at the same time, the eventual expression of the tradition is now called health psychology. See here, health psychologists will explain. Okay, what are the various reasons? What are the new interventions? Okay, what are the things they can work? Okay, and how they can maintain the healthy cycles. All these things they will explain. I think many people know at the time of Corona, people enhanced they worked upon the immunity system. Please take vitamin C. Okay, vitamin C. If you are taking vitamin C, the immune system will work. So yeah, this is the health psychology people role. They need to explain. Okay, what are the things to enhance their health? Or what kind of food habits they need to maintain? So all these periodic epidemics from 18th century to till now, what are the influences people have? We need to explain and we need to give that idea to the people. So these are all the things. First, actually, how this health psychology is started. Actually, from the 18th century onwards, it's there. Okay. Actually, ancient Greece and Rome, uh, at the time 500 to 300 BC, okay, documented many ideas about the health psychology. Hippocrates, the father of medicine, proposed the theory of humans. Okay, according to this theory, the human body consists of four fluids called humors. One is the animal fluid. Okay, when the balance between these humors is achieved in an individual, is yeah, we can consider it as a healthy person or a healthy personality. Actually, the disease occurs when there is a mix of these humors. Hippocrates said, recommended that the maintaining of a good diet and avoiding excess can help achieve the uh, good humorous balance. Okay, even Plato and Greek philosophers are behind the novel idea in the time. Okay, these people also supported him. Galen was the first physician of the second and BC study of the anatomy of animals and identified the various parts of the body. Okay, he explained about what is anatomy and what is the part and what is the impact, what are the things and all these things. In the Middle Ages, with the end of like Roman Empire, life in the Western world had become still in Europe. These people left, but still there, yeah. So here, at the time, the religious people, they used to think it's a God's punishment. If anything comes, yeah, no, 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 don't worry about this. It's a God's punishment. Please go. So here, the Italian philosopher, Mr. St. Thomas Aquinas, had rejected this theory. Okay, rejected this belief system. He said the mind and body are separate and saw them an integrated whole. Okay, next, the Renaissance and after. Renaissance means rebirth, an apt name for the 14th and 15th centuries. Actually, at the time, they used to believe more on the rebirth in this those. So, a sense of inquiry, culture, and politics mm, was seen in Europe. Actually, here the scholars had become more human centered than God centered. In the 17th century, Reines describes a philosopher and a mathematician give 4 points. What are the points he has given in the Renaissance? The mind and the body are like a machine. Okay, he put it into four things. Mind and body can communicate to the pineal gland. Animals had no soul, and human soul left upon the death. So what he said, the human soul will death after the person body is died. So here they even explained about the surgery improved and the importance of the practitioner-patient relationship, practitioner-patient, and even help the between increase the trust between the physicians and patients. See, earlier, see, the soul is going down. Yeah, these are the things will happen. It's not going to be effective. But these are the things we need to see. So, but here they explain. Now, biofeedback. What is biofeedback? Biofeedback is a mind and body technique. Here, what we will do, we will understand individual learns and modify their physiology in order to improve physical, mental, emotional, and spiritual health. Okay. Next session, we are going to discuss about the behavior and health. What is the behavior? Next, this is the next chapter. Okay. Here, what is the human behavior of the people? How they enhance to maintain good behavior and good health. Okay. Whenever we are talking about the poor health behavior may result in becoming bad habit and may lead to illness. That's the reason people need to follow the healthy behavior. healthy diet, not smoking, exercising every day, and yeah, it even takes the using mobiles, taking precautions. All these things will be there. Okay, now we'll discuss about the concept of the health behaviors. Okay, first thing here we have first thing sleeping for at least 8 hours in the night. Okay, that is a good health. We discuss about the good concept. What is good health? And avoid smoking, drinking, other habits. Eating healthy breakfast every day. Few people what they do say, why should I eat the breakfast? I'll directly have lunch. Okay, but healthy eating is first thing and not ever. The every person needs to have breakfast. So I mean, see, suppose without your breakfast, if you're having direct lunch, you are having a night dinner, but by the time your body needs rest, your body will tired, and yeah, so you need to have healthy breakfast in the morning, and avoid consumption of alcohol, a limit or it one drink. Whenever you are having everyday alcohol, you need to limit yourself. Regular physical exercise is required, and avoid eating between meals. Few people, what they do, they'll have breakfast. Again, they will start. Or someone is eating breakfast. Again, they'll go with something, or else they'll eat lot of snacks like junk foods. Okay, these things we need to avoid. Not being more than 10% overweight. See, whenever we are checking the weight, we need to see. We need to mark with the BMI. Suppose if 10% is okay, if it is more than that, then it's called a unhealthy. Healthy, not healthy. According to research by Mr. Kavi Ketal, okay, actually he studied on adults with healthy lifestyle and expected to live 12 years longer than longer than they would. Okay, he studied on people and he come to this conclusion. Suppose if the person is having healthy aspects, he can live more than 12 years when compared to other people. Actually, whenever you are discussing about the behaviors, most of the behaviors based on the symptoms and based on their activity. When people look for remedy for their problems. See, actually here, whenever we are seeing the sick person is behavior is different, and even his activity is completely different. Okay. And we need, see, it depends on the illness, we will diagnose. Based on the illness, we will see what is the suppose someone gets the stomach infection. Okay. How to treat? What the basic things? And what is his daily health? So based on the things, the physician will help the person. Now we'll discuss about the characteristics of the health behavior. Actually, Mr. Matraju in 1984 defined that health behaviors as health impairing habits and health protective behaviors. Actually, here health impairing behaviors including like smoking, maintaining good diet, and diet consuming with a high fat, etc. And health protective behaviors included health checkup, healthy sleeping habits. See, suppose if the person is unable to sleep, we already discussed it. Okay, he do have some problem. Now, what is the healthy diet? People will say, hey, eat healthy, stay healthy. What is the healthy diet? See, whenever we are talking about the healthy diet, we need to see first thing the proteins. What kind of proteins are you intake? And vitamins, minerals, carbohydrates, etc. First, vegetables should be eaten per day. Okay, that means the food containing complex of carbohydrate which rich fiber like wheat, bread, all these things will come. Even the potatoes, boiled potatoes, and should be eaten on regular basis. Okay, yeah, meat, fish, and other alternatives can be consumed in the modern amounts of, okay, with low fat. See, few people, whenever they're eating this food nowadays, they will go with the uh, deep fried. We should avoid it. And sweets and sugar food should be consumed in a smaller amount. See, why? Suppose if you are eating a lot of sugars in a bigger amount, what will happen? Yeah, it's effective. And exercise. Every day, the person needs to exercise. Why? See, suppose if the person is not exercising, like what are the things we need to do in exercise, like walking, climbing, yeah, doing yoga. It's all comes under. Actually, this one said by Mr. Pfeffinger in 1986. He studied for 2.5 years. And if the person is unable to take who reported like physical exercise not there, their person for them it's very they can't even do staircase. They have only this and even the result shows because of that. the BP is high, and yeah, even we can say coronary heart diseases are very high, and obesity and diabetes. Diabetes is also high if the person is not doing any kind of activity. And yeah, psychological benefits of exercises means, say, they can reduce their anxiety, they can reduce their mood swings if the person is doing this. And yeah, even if the person is working hard in the gym or on the ground, yeah, it enhances their mood and it boosts their self-esteem, and even the confidence level also a little bit high. Okay, if the person is doing the exercise, if the person is not doing, yeah, he can't even take a staircase. Smoking and alcohol. If the person is limiting to himself while having smoke and all alcohol, it's good for them. Suppose if it increases, then it turns into a disorder like liver cirrhosis or cause of cancer or liver and pancreas or increases the hypertension. And yeah, it may causes more memory defects also. Okay, and he can't, even the smoke, it may lead to cancer and all other things. And it even harms himself also. And body weight. See, body mass index is very important. So if the person is crossing the BMI, we call it as a obesity. Okay, here if the person is more obese, then chances of diabetes is very high, joint trauma is very high, hypertension is high, and all the health issues are very high. So here, obesity can cause low self-esteem and poor image. See, if the person is looking good and he feels good and he's healthy, he feels like, yeah, I'm good, I can deal. But the person is unhealthy and underweight, it may lead to malnutrition and cause health related. If the person is underweight, he will say, oh no, I can't do this. Every time he'll be into the lazy world. So he can't manage eating disorders. The main eating disorders, most of the times are anorexia nervosa and bulimia. Okay, here the association with the pathological disease not to gain weight. Okay, here the person weight of the person is reduced the half of the normal weight, then it's a disorder only. Losing weight or being underweight, okay, cause menstrual problems in women. And men and women were more susceptible to infections and any under. Suppose if the person is having low weight, okay, immunity is very less, the chances of getting into diseases and all other things is very high. So here we need to check what are the reasons. Next thing, we'll discuss about the factors implying the biological aspect. So these are the things, yeah, we need to check and we need to see how the person is taking, how the person is managing with the food and what kind of the intake, what is the outflow. All these things we need to discuss. Based on that, we need to tell the person, see, being a health professional, I am saying, please don't do this and all. And by that only, we can even understand the biomedical social model and to reduction the model. Here we can see the illness and reducing the illness and what are the chemical imbalances happening within his brain. See, whenever the injury is more, whenever, okay, when he person have a understanding of this thing, he will understand his disease more and he will work well. So here, Alexander and Dumbara disagreed with the Freud's theory of conflict-causing symptoms like anxiety are reduced through voluntary systems. The rather state that anxiety is unconscious process which results in physiological symptoms via autonomic nervous system. But these physiological changes results are chemical. That's the reason these people get psychosomatic. Okay, and if people need to reduce the illness, they may use psychosomatic medicine for that. Okay, even the repressed emotions will turn into what do you call it? Stress. Okay, and conflicts, hyperthyroidism, ulcers, hypertension, how there were many over there in the this environment. So these are the things we need to check in the health psychology whenever we are practicing the health psychology. Chalo then, bye. Thank you. Have a good day.